Diabetes is a chronic medical condition in which sugar, or glucose levels, build up in your bloodstream. The hormone insulin helps move the glucose from your blood into your cells, where it's used for energy. In type 2 diabetes, your body cells aren't able to respond to insulin as well as they should. In later stages of the disease, your body may also not produce enough insulin. Uncontrolled type 2 diabetes can lead to chronically high blood glucose levels, causing several symptoms, and potentially leading to serious complications. Before we proceed on this topic, I would like to share with you a video by a grandfather who successfully reverses type 2 diabetes with an odd diet hack. You may follow the link in the description below to find out more about it later. In type 2 diabetes, your body isn't able to effectively use insulin to bring glucose into your cells. This causes your body to rely on alternative energy sources in your tissues, muscles, and organs. This is a chain reaction that can cause a variety of symptoms. Type 2 diabetes can develop slowly. The symptoms may be mild and easy to dismiss at first. The early symptoms may include constant hunger, a lack of energy, fatigue, weight loss, excessive thirst, frequent urination, dry mouth, itchy skin, and blurry vision. As the disease progresses, the symptoms become more severe and potentially dangerous. If your blood glucose levels have been high for a long time, the symptoms can include such as yeast infections, slow-healing cuts or sores, dark patches on your skin, a condition known as acanthosis nigricans, foot pain, and feelings of numbness in your extremities, or neuropathy. If you have 2 or more of these symptoms, you should see your doctor. Without treatment, diabetes can become life-threatening. Discover other symptoms of type 2 diabetes by following the links in the description below. Insulin is a naturally occurring hormone. Your pancreas produces it and releases it when you eat. Insulin helps transport glucose from your bloodstream to cells throughout your body, where it's used for energy. If you have type 2 diabetes, your body becomes resistant to insulin. Your body is no longer using the hormone efficiently. This forces your pancreas to work harder to make more insulin. Over time, this can damage cells in your pancreas. Eventually, your pancreas may not be able to produce any insulin. If you don't produce enough insulin, or if your body doesn't use it efficiently, glucose builds up in your bloodstream. This leaves your body cells starved for energy. Doctors don't know exactly what triggers this series of events. It may have to do with cell dysfunction in the pancreas, or with cell signaling and regulation. In some people, the liver produces too much glucose. There may be a genetic predisposition to developing type 2 diabetes. There's definitely a genetic predisposition to obesity, which increases the risk of insulin resistance and diabetes. There could also be an environmental trigger. Most likely, it's a combination of factors that increases the risk of type 2 diabetes. Find out more about the causes of diabetes by following the links in the description below. You can effectively manage type 2 diabetes. Your doctor will tell you how often you should check your blood glucose levels. The goal is to stay within a specific range. Follow these tips to manage type 2 diabetes. Include foods rich in fiber and healthy carbohydrates in your diet. Eating fruits, vegetables, and whole grains will help keep your blood glucose levels steady. Eat at regular intervals. Only eat until you're full. Control your weight and keep your heart healthy. That means keeping refined carbohydrates, sweets, and animal fats to a minimum. Get about half an hour of aerobic activity daily to help keep your heart healthy. Exercise helps to control blood glucose too. Your doctor will explain how to recognize the early symptoms of blood sugar that's too high or too low, and what to do in each situation. They'll also help you learn which foods are healthy and which foods aren't. Not everyone with type 2 diabetes needs to use insulin. If you do, it's because your pancreas isn't making enough insulin on its own. It's crucial that you take insulin as directed. There are also other prescription medications that may help as well. In some cases, lifestyle changes are enough to keep type 2 diabetes under control. If not, there are several medications that may help. Some of these medications are metformin, which can lower your blood glucose levels and improve how your body responds to insulin. It's the preferred treatment for most people with type 2 diabetes. Sulfonylureas, which are oral medications that help your body make more insulin. Meglitinides, which are fast-acting, short-duration medications that stimulate your pancreas to release more insulin. Thiazolidinedians, which make your body more sensitive to insulin. Dipeptidyl peptidase 4 inhibitors, which are milder medications that help reduce blood glucose levels. GLP-1 receptor agonists, which slow digestion and improve blood glucose levels. Sodium glucose cotransporter 2 inhibitors, which help prevent the kidneys from reabsorbing glucose into the blood and sending it out in your urine. Each of these medications can cause side effects. It may take some time to find the best medication or combination of medications to treat your diabetes. If your blood pressure or cholesterol levels are a problem, you may need medications to address those needs as well. If your body can't make enough insulin, you may need insulin therapy. You may only need a long-acting injection you can take at night, or you may need to take insulin several times per day. Before we end up this video, I would like to share an important new information about one green veggie that worsen diabetes type 2 symptoms. Find out more about it by following the link in the description and comments section below. And also, if you found this video helpful, please don't forget to share it to others. Thank you for watching.